We're good.
Okay, I'll go ahead and call the meeting to order. We'll hope that Ken gets on. We do have quorum now. We'll turn to Calissa for roll call, please.
Thank you, Madam Chair. Sue Carlton,
Present?
Brian Milne, Brian Milne, Brian Milne, Kevin Eckel,
Counted for. He's here.
Chris Peabody,
Present.
Sue Patterson,
Present.
Helen Claire Tingley,
Good morning.
Kenneth Craig, Kenneth Craig, Kenneth Craig, Nick Saunders,
Good morning.
Chad Richards, Chad Richards, Chad Richards, Beverly Wilkins, Beverly Wilkins, Beverly Wilkins.
Thank you. Are there any amendments to the agenda today? Additions to? Seeing none, we will go to approval of the agenda. The recommendation being that the agenda be approved by the Board of Health as presented. Then have a mover and a seconder. Sue and Kevin? Any discussion? Call the vote, all in favor? That is carried. Is there any disclosure of pecuniary interest? Seeing none, you may declare at any time if one should arise. For adoption of the minutes, we have minutes from the Monday, September 23rd, 2024 Executive Committee meeting and Friday, September 27th, 2024 board meeting. Are there any concerns with any of those minutes? Seeing none, the recommendation is that the minutes be approved by the Board of Health as presented. Could I have a mover and a seconder, please? Chris? Kelly? Any discussion? I will call the vote, all in favor. That is carried. Correspondence and media releases. Turn to you, Dr. Rare.
Thank you, Madam Chair. On the correspondence list, we have 3 items. The first one is a letter from the Sudbury District Health Unit directed to the Minister of Health for Canada. And the letter commands the Minister on the order that was introduced earlier in the fall to implement safeguards measures regarding nicotine replacement therapy and close regulatory gap that allow the sale of nicotine pouches to youth. And the letter goes on to name this as a step in many other steps that could be considered. And the recommendation there is to receive. The second item, Madam Chair, is correspondence from the Executive Council of Ontario, signed by the Lieutenant Governor for Ontario, and the renewal of the appointment for Mr. Chad Richards on the Board of Health for a period not exceeding 2 years, which is a maximum for the provision the renewal period. And the recommendation there is to receive, and Madam Chair, I'll turn it back to you for a word from Chad to the board.
Thank you. Chad sent an email out this morning saying he was unable to be here today, but he wanted the following to be read on his behalf. So he says, I am honored and delighted to have been reappointed to serve as director on the Board of Health. I look forward to working together with all board directors, Dr. Era, and health unit staff as we continue to advance initiatives and provide sound oversight of an organization that makes a meaningful impact in the lives of the people we serve.
Thank you, Madam Chair. The recommendation there is to receive as usual as process, and the third item is letter from the Sudbury District Health Unit to the President and Chief of the Executive Officer of Public Health Ontario and the Minister of Health. And the letter is addressed to ensure that testing of private well water testing, the provincial program continues to exist with the changes that are happening in the laboratory for Public Health Ontario in terms of just the background of the item, the Public Health Ontario Labs announced a number of changes for the future, and in their announcement, they wanted to turn that service to private labs as well. Testing in general, include private labs in the process of testing to optimize it. And in two occasions that I attended, they emphasized that water testing will continue to be done through private labs, if not through the private, the public laboratory. Nevertheless, Sudbury Health Unit is putting this call out for the importance of the item and the testing of private well water testing. Sorry, I'm repeating the skip word. Again, I do know that there is well knowledge in the system and commitment to doing the testing. The fact that the Sudbury Health Unit has concern about testing, I would recommend to endorse the letter, the correspondence. There is importance for the water testing. It goes without saying, especially for us living in a rural area. Open to questions as always, Madam Chair.
Thank you. Any questions or comments by anyone? Seeing none, the recommendation is that the correspondence be received and endorsed by the Board of Health. Could I have a mover and a seconder, please? Chris? Ellen Claire, can I call on you?
Yes, thank you, Madam Chair.
Any further discussion? Seeing none, I will call the vote. All in favor? That is carried. Moving on to media releases. I see Denise on with us.
Yes. Thank you, Madam Chair, and through you. There are 3 media releases on this month's agenda. The first, dated October 11th, advised the public that Grey Bruce Public Health had issued an opioid alert after receiving reports of 1 fatal and 2 non-fatal suspected drug poisonings over a 3-day period. The media release reminded people who use drugs to always follow harm reduction strategies when using unregulated substances. The second release, issued October 17th, coincided with the release of Public Health's latest report on food affordability. The report calls attention to the struggles many Grey Bruce households face to afford basic living expenses, such as adequate food and monthly rent, as incomes and social assistance rates fail to keep pace with rising costs. And the third release, issued October 18th, provided information on vaccines available this fall respiratory season. Public Health is encouraging residents to protect themselves this fall by getting the updated publicly funded COVID-19 vaccine and this season's flu shot as soon as they become available. The general public can receive this season's COVID-19 vaccine and flu shot from their primary care provider or at participating pharmacies starting October 28th. And Grey Bruce Public Health will be holding vaccine clinics in November for children under 12 and others who are facing barriers to getting vaccinated. And that concludes the media release report for this meeting.
Thank you. And I will turn to the board. Any questions or comments on those media releases? Seeing none, the recommendation is that the media releases be received by the Board of Health for information. Could I have a mover and a seconder, please? Sue and Kevin, any discussion? I will call the vote. All in favor? That is carried. Moving on to medical officer of health update.
Thank you, Madam Chair. So we have 4 items. The first 2 are standing items, and they continue to function as planned, whether it's related to the COVID situation, or the second one is strengthening public health. It's the work that the ministry is doing on updating the standards, and to my knowledge, it's the new standards will be released early in 2025. That's still not changed. The second 2 items, the third and the fourth item, are related to reports from the infectious disease program and the vaccine program, and I'll turn it to the Madam Chair to Andrew.
Thank you, Reverend.
So the first of these updates is from the infectious diseases team, and it's essentially an overview here. So key points of the report are that there has been an increase in participant activity locally, which reflects an increase across the province. In response to the increasing local cases, Great Public Health continues ongoing surveillance and also, of course, case and contact management activities, as well as targeted communications for local healthcare providers. The Ministry of Health recently updated the COVID-19 test eligibility criteria, reporting processes and outbreak definitions. That's a change for this respiratory season. And Rotary Public Health's infectious diseases team continues to work closely with partners, a broad number of partners across institutions, long-term care, retirement homes, congregate buildings, and so on, to assist in ensuring their readiness to respond to the upcoming respiratory season, as well as engaging in ongoing communication with other partners and, of course, the public on COVID-19 and other respiratory illnesses. So we have a little bit of an update as well from avian influenza. I think that's an ongoing point of interest. So in 2022, we did have 3 investigations of bird flocks infected with avian influenza A in Grey Bruce. We haven't had an infected flock since then. So obviously that's good, but there continues to be a sort of background possibility of future flocks being infected. However, the risk of avian influenza A to humans remains low. I think that's about it for this summer. Any questions?
I will look to the board. Any questions? I don't see any, so you're carrying on with the vaccine?
Yes.
Question as well?
Yeah. So the next report is from our vaccine team and specifically on the Immunisation of Schools Pupils Act, so ISPA compliance. So as the board probably realises, the COVID-19 pandemic did have a significant impact on ISPA compliance in Grey Bruce. The BPD team experienced approximately a 4-fold increase in non-compliant student records compared to pre-pandemic. So we're talking about there an increase from approximately 1,500 to a little over 7,000. So since that time, the team has been working hard to reduce that number. Obviously, as you appreciate, people keep being added to that list as well as reducing it down. But the team has been successful in reducing the non-compliance numbers down to approximately 3,500. So a significant decrease to where we were just after the pandemic with over 7,000, but obviously still quite a bit higher than where we were prior to the pandemic. So we're stating there's a 50% reduction in the amount of non-compliance, but again, obviously that doesn't necessarily fully capture the fact that people are still being added to that list. So we are still continuing to further reduce that backlog, and hopefully we can continue somewhat with the trend of reduction that we've seen.
Madam Chair, there are 2 points probably we need to add into the report. My apologies, like they're key, the stats. The total number of students who are captured by this regulation or law in Grey Bruce are around 24,000. It's either 23 to 25, depending on certain criteria. So on regular years, the number of people who say, I don't want the vaccine, I'm not going to comply with this, it's around 1,500. And that's across the province. It's not an issue related to Grey Bruce. And 1,500, then after the pandemic, because of the backlog was addressed, which is people want the vaccine, is it available or not? No, it is available. What happened is a number of individuals or families decided they're not gonna have that confidence in the vaccine, they're not gonna vaccinate their kids. And that increased from 1,500 to 3,000. So it doubled. However, when you look at the total number of kids in Grey Bruce that qualify for this 24,000, it's 1,500 change from 1,000. That's around 7%. So 7% of the public has changed their opinion. And we can continue to work, communication mainly, and offering the vaccine is available and we have the capacity to deliver it. It's just the confidence in the vaccine efficacy and safety has been reduced after the pandemic for many reasons. So those 2 points would probably need to be added to the report, Madam Chair.
Okay.
Well, the number is 25,000. I wanted to be conservative.
Any questions from the board?
Yes.
Go ahead.
Just for clarification. There wasn't the vaccination for, diphtheria, rubella and whatnot. Did that move up as well too, or is that included, or is it just the COVID vaccine that people were refusing, students were refusing, and that gave us the extra 1,500?
Through you, Madam Chair, so that the ISPA Act regulates all mandatory vaccines, including the ones you mentioned, the measles, rubella, all of them. So during the pandemic, the program to provide the vaccine to school kids stopped, and we only focused on COVID, and the schools closed. So that backlog happened because of the provincial direction to do that. And after we as a health unit, we provided the vaccine in 2022, 2023, the backlog was completely eliminated. However, what's left is people confidence in general in vaccines, including rubella, measles, pertussis, all those. And again, when you look at the number 3,000, it's significant. However, 3,000 out of 25,000 is around 15%, if my math is right, I think correctly. And the change, the actual change, the regular number is 1,500, and it doubled from 7% to 15%. And again, it's an issue that I do believe it's across the province, across North America in general. There is that notion that vaccines are not safe. And vaccines are different products. Measles has been used for many years. COVID has been used for a few years. The level of understanding and confidence in them are totally different.
Yeah, okay.
So a question that I have, and I'm gonna date myself here. When I was going to school, the doctor just came in and we all got a vaccine. I don't remember anybody asking. Does the health unit still, or someone go into the schools to administer these, or it's on the parents to get their children to their family doctor for them? How does the vaccine system work now?
A combination of those. Like in general, people would go to their family physician, and pharmacies recently have been giving vaccines. During the pandemic or after the pandemic, after the emergency, we went with clinics to schools to provide the vaccine as easy as possible to the families and kids.
So then as a preliminary step to that, would you have to have written permission from the parents for each child to be vaccinated when you went in?
Definitely, yes.
Okay. So parents would very definitely be aware of the process going on. Any other questions from anyone? Seeing none, the recommendation is that medical officer health update be received by the Board of Health for information. Could I have a mover and a seconder, please? Chris? Helen Claire? Please no further discussion. I will call the vote. All in favor? That is carried. And moving on into corporate services to Kim.
Through you, Madam Chair, this is the August 2024 financial update. As of August 31st, we had a surplus of $354,000. The seniors dental surplus was $130,000, and all the remaining programs had a cumulative surplus of $244,000. Our Healthy Babies, Healthy Children program, which is funded by the Ministry of Children, Community and Social Services, received an increase for 2024-25, which is the first funding increase that program has received in a long time. So I've been here just over 10 years and this is the first increase I've seen, so I'm not sure how far back it goes, but it's good news. So reflected in the statements is that increased funding for April to August. And then otherwise, all our funding streams are currently aligned with our budgeted expectations. Our salaries and budgets are under budget by about 119,000 due to some gapping and vacancies in positions while recruitment has taken place. And for our operating expenses, this has been ongoing, working with managers to identify where there may be surplus in their operating budgets to kind of get an idea of what kind of surplus we can expect at year end. So there is a plan underway to utilize that surplus in the form of a mortgage lump sum payment, which is another agenda item that we'll discuss in more depth. But that's the plan currently in progress. For our capital project, the Walkerton Dental Clinic is complete, but we are still waiting for confirmation from the ministry about the funding. I have communicated to the ministry that the project is complete and also that the initial forecast or amount we estimated we would need for the project, that was on track with where the cost ended up. So still hoping we'll get some kind of confirmation from the ministry soon about that.
Thank you. Any questions for Kim before we move along? We are a very quiet bunch today, apparently. I suggest we move on to the next part, right?
So through you, Madam Chair, I'm bringing forward a recommendation that the Board of Health approve a repayment of $300,000 on one of the outstanding swap agreements we have that matures August 2nd, 2033. So we currently have two swap agreements, or essentially you could call them mortgages, on the building. One is for a larger amount, one is for a smaller amount. I have communicated with the ministry as to whether or not putting a lump sum down is permissible use of our any surplus we have, and it is. And I've also spoken to our VC about it, and it's also within the terms of our agreement that we can put down a lump sum payment. The strategy behind that is if we can get rid of one of these mortgage payments, then that frees up that money to put towards operations and positions. So this will just get us that much closer to paying off one of the loans. The smaller loan does have a lower interest rate than the larger loan. So there is a penalty to putting a lump sum down on the larger loan. There's no penalty to put a payment down on the smaller loan. Over the remaining life of the loans, you would save a bit more interest by putting it down on the larger loan. But if the strategy is to pay off one of them to free up some operating dollars, then the smaller one is a more realistic and feasible one that we could pay off in the shorter term than the larger one. So based on that, my recommendation I'm bringing forward is that we use the surplus from this year to pay down the principal remaining on one of those mortgages, which will get us, it'll cut out about a year off the remaining life of that loan, bring us that much closer. And we can also continue to explore the possibility of repaying one of them in full in 2025.
Thank you. Questions or comments? Kevin?
So the idea is that we're paying down the mortgage to free up capital funding to put into operations.
For you, Madam Chair, so you wouldn't be freeing up capital funding, you'd be freeing up operating money. So out of our
This is mortgage money, so that's on capital. That's capital.
right, so we take from our operating budget. From our operating budget, we expense the cost of the principal repayments and interest. So there's a line on our statements called internal rent. That's about $91,000 a month. So that's going over to the capital fund, and the mortgage and interest principal payments are coming out of the capital fund. But essentially, funding those payments is our operations. So if we didn't have to, if your mortgage payment and interest are lower because you've gotten rid of one, then that internal rent line in our operating statement could go down, which would leave more money in operations for staffing and other expenses.
Dr.
Madam Chair, just in terms of how this come to be, we do have physician consultant position open, not filled for the whole year. The recruitment is going well relatively to other health units that are trying to recruit. Nevertheless, the usual salary for that position is going to be saved, or is going to be part of the surplus. This surplus by the end of the year, if we don't utilize, goes back to the ministry. So Kim comes with very innovative way. This provides us flexibility. If we invested into the capital, into paying the mortgage, will give us the flexibility to use it down the road when that mortgage is free or completely paid. In general, that's the. In my opinion, it's a very nifty way. It gives flexibility to the organization to manage money over a number of years and be within the regulations that we operate under. And whether it is implemented or not, I do believe it's a worth presentation to the health club, because other health units might benefit from this situation as well. Nevertheless, it's a recommendation. The board can continue to assign the payment as usual, and all in all, I see it as a success in management, financial management of the organization. With credit to him and her team to allow us to flexibility use the funding in different ways. We don't have to follow these recommendations. They're just recommendations for the board.
Thank you. Ken, go ahead.
Thanks, Madam Chair. I would support the recommendation as presented. The challenge with any business is not necessarily the cash you have or the ability to pay the mortgage. Cash flow is much more significant than down payments or anything. So the intent of the accelerated mortgage payment, get rid of the smaller loan. It doesn't have some of the advantages, but the logic behind our director's recommendation for me is very logical. You don't want to stress your cash flow. You want to make it towards the loan that will make the best financial gains in the short term. So at this point, so I would concur with the recommendation.
Thank you, Dr. Rare.
Madam Chair, I wanted to add that Kim did due diligence to connect with the bank, with the ministry, and I believe the auditors. I don't know if you connected with them yet or not, but that was a plan. So everybody's on board that this is within the appropriate next step in management.
Okay, thank you. Any other comments? Seeing none, the recommendation here then is that financial report for August 2024 be received by the Board of Health for information, and that the Board of Health approve the repayment of $300,000 on the outstanding swap agreement that matures August 2nd, 2033. Ken, were you saying that you were moving that motion?
I would be glad to.
Thank you. Could I have a second then, please, Chris? Any further discussion? Did you have another comment, Kevin, or your vote?
Well, just the recommendation, and there's the three options there. But in the recommendation, I guess I just so that there's a connect, it'd be the recommendation, option number 2 is the one that we're going with. In the recommendation, it really doesn't say that, it just says the 300, but I would just like to see it, that option 2.
Okay.
Yeah.
Can that be considered just a friendly amendment to that motion?
I would agree.
Okay, thank you.
Thanks, Kim.
Any further discussion? Seeing none, I will call the vote. All in favor? And that is carried. Other business. Well, falls and closing. I bring all of this back over to you, Dr. Rare.
Yeah, thank you, Madam Chair. So this is just a reminder that the Alpha Falls Symposium is upcoming. It's always encouraged, the board members are encouraged to register for it. If anybody's interested in attending, it's virtual. To email Kalista and she can arrange for that registration. That's the first item, Madam Chair. Board membership update. So this is an item that's related to Chad's recent renewal of membership. That's one item. The second item is Mr. Luke Sharp submitted his resignation to the board, and Bruce County most likely will appoint somebody else. So with this change, it is good practice to have an inventory for skills on the board to send to the ministry or send to the counties or both to say basically we have those set of skills on our board and those are needed. And some of the skills could be local political leadership. We have a number of people around the table, many people around the table that have that skill. It could be somebody with HR background, somebody with finance background. So whatever that inventory outlines, we can provide these recommendations to the two counties and to the ministry. Say, in your next selection or appointment, please consider those skills. So again, I don't know if that covers the item that we wanted to talk about today. I'm not sure.
So I would turn to Chris for where Bruce County is at on reappointment.
Well, we were just gonna wait a little bit, as you know, with the counties, they redo, appointments for all committees, at the midterm, which should be December for both counties. We're just gonna wait and see till then. I don't think it presents a problem having a vacancy. I'll leave that to you, but, thought we'd, take time to do our, due diligence, and who knows, Luke's running for warden, maybe he'll be back. If he wins.
Okay. I do think that listing of skills would be a good thing. My understanding is that used to be available and sent to both counties and the Ministry for Public Appointments. So it might be helpful if we could take a look at that again.
I know other health, some other health units have that inventory, and again, the county and the ministry have their jurisdiction and authority to appoint whomever they see fit. However, this would allow our board to provide that list and for consideration. And I know many people around the table have experience at the county level, and I wonder if this is something that you would see the county would welcome or would consider. Thank you.
I will look to other county council members. Chris, go ahead.
Well, Doctor, I'll just, I know we had, to give you a different example where that didn't go very well, Ontario Power was having some, revenue problems, and, well, the board was trying to dictate who the municipalities appointed, and that didn't really turn out very well. So our experience at the lower tier, the Brockton, that wasn't received very well with Ontario Power, just giving you an example, because the municipality wanted to reserve the ability to appoint somebody who is going to maybe address some of those financial problems.
But
If I could first, I don't think the idea here is to suggest who gets appointed,
Okay.
but to say, here are the skill sets that would be advantageous to the board if somebody has those skill sets and is interested in applying. But I don't think it would be the board of health saying specifically, this is what we're after.
Well, that would be fine. The case of Westeria, this was a few years ago, they were asserting that they were going to block the municipal recommendation. So I'm not hearing that here, but I'm just saying it's a slippery slope where you can
Yeah,
get into that with boards.
Madam Chair, I thank you. I agree with you 100%. Nobody can dictate to a county. It's a self-regulating body. It's creation from the ministry. If the ministry or the province wanted to change things, they can. But as a board of health, there is no jurisdiction to say, no, don't appoint this member. And some health units implemented a process of interview, but even in that process, the interview itself is not decisive. It's more to introduction or to introduce the member to the process. But the county will be, or the ministry, there will be both of them appointing their own members. So there's nobody who will dictate. As the chair mentioned, it's a list of skills that are required on boards or not required, encouraged on boards.
Yeah, okay.
Be considered.
Nope, that language would be appreciated. I can understand it, encouraged. Kevin and I probably would refer to another board, the South Bruce Grey Health Center, where some of the perhaps the board candidates we've preferred have been blocked. So it's another example of a board like keeping an iron gate against who they won't let on the board. But as long as it's, these suggestions,
Yeah.
that's great.
Helen, so before I go to you, just a comment, from my perspective, if I were looking at putting my name forward for a board, it would be helpful to know what criteria would be needed on that board. Helen Claire, I'll go to you now.
Yes, thank you. Thank you, Madam Chair, and thank you for that excellent point. When I was on the executive, we spent a lot of time with this, and I would like to say a couple of things in response to my colleague, Mr. Peabody's concerns. In the legislation under which we operate, this board has no capacity to block, veto, or interview and make determination on who comes. It's very, very clear that the appointees from the county level come from the county level. And so to Madam Chair's point, the suggestions were just about making sure that people that consider that they'd like to be on this board are aware of the concerns, aware of some of certainly what the responsibilities are, but where the gaps are too, and also are aware fully of the time commitment, that this is something that it's not the library board or the cemetery board. This is a critical area, the health of both counties, and it requires that people, that even if they're interested, that they know this is the requirement. You show up, you have to do this kind of work. This is the current makeup of the board. We desperately need people that have this, and this skill. And that way each individual can determine, is this really right for me or not? My final point is, I have lived in this community for over 30 years, and I know this community has bright, engaged people, and many of those people are our municipal leaders and are represented at the county level. I therefore have every confidence that the people with the skills we need at this board exist at the county level. We just need to make the case for them to realize what's needed and encourage those very people to step up so that this board will be able to work at its highest level. Thank you, Madam Chair.
Thank you. Very good comments. Any other comments from anyone? I'm going to let you Dr. Eric. Do we need a direction to do this, or this is something that was already available and we just need to bring that forward?
I believe it was available, Madam Chair. It could be available, and it is available in other health units if the board directs us to explore some initiative like right in some other health unit and bring it for consideration. It could.
Okay. Is that something the board would like to give direction on? Give us that brought forward. And do we need a motion to that effect? Or just direction?
Direction.
Just direction? Kevin?
It's always a scary slope. And I think what we're here for, it's more philosophical, we're here as a governance board. And I struggle when we start recruiting or going out to recruit specific skill sets that is needed on a governance board. And here, the idea, you know, of somebody that's got an HR background or somebody that's, you know, on a health unit, got a medical background. We're pulling away, you know, you're using that almost, you know, to get into operations. And as a governance board, you know, we're not that. And I think individuals, and I've seen it, that have come on the board with those, you know, really specific or, you know, professional skills, they're brought onto the board. And Kim, hope you don't mind, I'm gonna use, yeah. They're, you know, they've got a, you know, a chartered accountant and whatnot. And all of a sudden, they're really start diving down into the operations, the accounting. And it's, you know, it's that you need that to be governance, to be able to give strategy. But when you specifically go and start recruiting, the individual comes in, I've seen it with this thought, oh, they want me to really be the forensic auditor on this. What's going on here? It, you know, it's that slippery slope that when you start recruiting for on a governance board, which this is, we're not gonna help. I don't want to start doing operations and having to give vaccines to kids. That, yeah, where's that line between getting right down into operations and bringing more skill sets in the wall? I'm here, I've got to use it.
Is it recruiting we're looking for though, or is it just information for people to understand? If you're interested in being on this board, here are the skill sets that would be helpful. Helen Claire?
Yes, thank you, Madam Chair. Personally, I've never seen that, or I should say rarely, where someone has come in and tried to take over the actual position. So the example given, a chartered accountant would suddenly start to want to take on Kim's job. And if that were the case, the rest of the board would clearly be able to speak up and state, this is not superintending, this is operation. For example, for my money, I would rather sit around a table with people who are educated because they're more likely to know the difference between governance and operations than than an entire board of people that don't have any knowledge of that. I think we're as good as the sum of our parts. And if the individual parts are strong, we as a board can only be stronger. So I am not afraid of someone coming in with credentials. For the other people around the table that have credentials, the quality of the input that comes is very high. But I also suggest that as a board, we've wasted a lot of time in the last couple of years on things that if the composite board members had really understood the where the lines begin and end, we wouldn't, in my opinion, have wasted so much time on that. So that's what I wanted to say, Madam Chair. Thank you.
Thank you. Dr. Rare?
Yeah, Madam Chair, regarding the comment about the slippery slope of governance versus management, it's a real situation that happens many times. And as Helen Claire mentioned, as a board, collective of us, we can recognize it. And it's the best practice for the board to keep their eyes on the programs and their fingers out of the programs. That's the simplest way to say it. Yeah. Having somebody who specializes in certain things or have certain skills would again, on its own, is not the recipe for that to happen. Rather the opposite. Usually people who work in, let's say, realistic example, legal background. This board had consultation with lawyers multiple times, like any other board. And we had a number of people on the board who had law degree or practicing lawyers. And they're very clear about, I'm not providing an opinion to this board, but this is the type of lawyer that we need to hire. That simple decision, they can validate the lawyer's credentials. They can validate what type of opinion is complete or not. Similarly with finance or HR, we sometimes, more often than not, will bring a report here and it's approved. And if there is that extra lens of somebody who did the job, they can actually give more credit to the HR, to the finance about the excellent job they've done, instead of the MOH only trying to say they did a really good job. It will come from within the board, that validation. The risk of slippery slope is real. I only do 100%. However, there are enough rail guards in our policies to identify it and prevent it when it happens or when it begins to happen.
Thank you. So if the direction were to go that way, so go ahead, Chris.
Well, I just wanted to agree with Kevin, and we've both been,
I want that in a minute. That's a pretty.
council, we've both been at council for a long time, and I know he and I can have several specific examples. The accounting seems to be the worst one, where somebody gets involved and starts trying to do the operations of the CFO, so. But let's see what comes back, and we can talk about it later. It's a good idea, but just wanted.
That was gonna be my comment, that if this comes back, then we on board can.
We can talk about
override.
it.
I see you've got your hand up.
Yes, thank you. I've been listening to the comments, all of them. And what has seemed to become an issue is more of certain, I don't know how to phrase this properly. I guess what I'm trying to say is that we're not working together as one, as a team in some senses. And that's what I've seen over the past couple of years is as a sitting person at this table. I think that operations is operations and governance is governance. And that we, as a governance table, we have to remember that we are at that governance table and we are not operations. And that we need to start to work together, because the work that needs to be done in all of our region here or counties needs to be done by the people that know how to do it. Yes, we need to know what's going on, but we don't need to be the pulse, if you want to put it that way, of how things are getting done. And I just, like I said, I've got a hard time putting this into words, but I hope it makes sense that we as a board need to start to come together to get the work done that needs to be done to serve the general public and the communities. Thank you.
Thank you, Nick. So I think we have our direction here, so perhaps we move on to the next item if there's no other comments on this one. And that is recognition of National Day for Truth and Reconciliation and missing Indigenous children in residential schools. Dr. are you speaking to this one, or is Nick?
Madam Chair, this item was on the agenda last month, and the board decided to defer to this meeting to allow Nick the opportunity to speak to it. So I'd be more than happy to speak, but I do believe Nick is more qualified for speaking to that item.
Thank you. Nick, are you ready to speak to this item? Can you hear us, Nick? Go ahead.
Yeah, sorry, I'm having problems with my computer here. I apologize. So you'll have to repeat that. I'm having a hard time hearing this morning.
Okay, so the item that we're at, we deferred from last month, and it's recognition of National Day for Truth and Reconciliation and missing Indigenous children in residential schools.
Yes, I believe that I believe that we should be recognizing this, and I know that the health unit is doing their part in this, um, and that this should be recognized as a holiday. It's you know, when I look at what's happened throughout the course of all of this, when it comes to the Truth and Reconciliation and seeing the impacts that it's had, and I was actually just speaking to a group about this yesterday, about the impacts that it's had on Indigenous people, and the fact of that it's led into the 60 scoop and things that are changing um, throughout time as this goes forward is not just the reconciliation. That's a buzzword almost now. It's about having that true and meaningful relationship and walking together and understanding one another and being able to show the next generation that's coming that there is change, that we as humans um are the worst of our own. We're the only ones that can start wars and end wars and can take away from Mother Nature as we start to um, try and create dominance. Mother Nature will always take care of herself. And I was just reading an article that just came up actually about the Jesuits releasing a property up in Wikwimikong that is going to be turned over to the Anishinaabe people up there. And the fact of that, I know I'm kind of going off on a tangent here, that they are releasing that land. Well, they never paid for that land. They never paid rent for that land. But yet they're saying they're going to release it back to the First Nations people. So it's interesting to see all of this. And going back to what I was saying, I think that we did, as a health unit, it would be my hope that the board would recognize that this is a big thing in history, and that we should recognize this as a holiday, even if the federal government doesn't want to or the provincial government doesn't want to recognize it. I know that the federal government is starting to, and I think we should be putting that forward to recognize that and be able to partake in ceremony and be able to go to Chris Peabody's region or Kevin's region or anybody's region that is asking or inviting us out there to be able to speak to it. Miigwech, I hope I made sense there. I'm sort of scatterbrained this morning, and I apologize.
Okay, thank you very much for your, what I find very thoughtful words, Nick. And Dr. Rare has pointed out that this is a holiday for the health unit. I think Georgian Bluffs has it as a holiday as well. Kevin, you had your hand up?
Yeah. Sorry you weren't here for the conversation last month, Nick. But, and I'll preface, I was the one that kind of brought it up and had it slightly deferred, or not slightly deferred, so we could hear from yourself. But in my mind, part of the conversation was, and I started it, that is one day enough? For a board, I just felt it, oh, great. Yeah, it's a feel good thing. We're endorsing this and the one day rah. And in my opinion, can we go further? We need to go further. It's something that's 365 days. The child that's missing is not missing on September 30th. They're missing 365 days of the year. And that was my is endorsing this enough, or how do we get more into it? Or endorsing this and moving forward? And I guess that's what I was looking for. You know, be able, for your opinion, endorse this and let us how do we continue to move forward? I guess it's the best thing.
Yes, I'll turn to you.
Yeah, sorry. I've had to put on my earphones here. I'm having a heck of a time this morning with my hearing aids and stuff. Kevin, I did get the most of your response there. 365 days a year is something we're losing the elders from the residential school, but we're also understanding that intergenerational trauma that has come out of that and gone into the 60 scoop and even into incarceration. Do we need to do more? There's always room for improvement, and we always, walking in parallel. Again, I'll say with an open heart and an open mind is always the best way and the best approach. I believe that one day is not going to be enough. This is trauma that has been around and continues to be around. And let's remember that the last residential school wasn't even closed until 1996, right? And then you went right into the 60 scoop as that was coming to an end in 68, and it hasn't even been until now that the government's starting to even recognize that and trying to push child reform on communities and stuff like that, of trying to keep the kids in the community so that they learn their culture, they learn the language, they learn that history of what it is to be a Anishinaabeg or a Haudenosaunee or Métis. So there's a whole, I could do a whole day's training session, an 8-hour training session, and that would just be the tip of the iceberg to understanding all the different things that have happened. I don't have it. I'll refer to it as a group that I talked to just in the past year. They had a picture on their wall. They called it artwork. They said it was beautiful artwork. And what that was an identification tag used that had the First Nations number on it with a safety pin, and it was a piece of leather that would be safety pinned to the person. And it was to show their identification number. And if they didn't have that tag on, or they wouldn't be able to travel because the Indian agent wouldn't give them permission to be able to travel or hunt for food or subsistence for their family. That happened here in our own communities in Ontario, even. That the Indian agent would give the families permission to be able to say, you can have 2 rabbits for your family of 12. And that's all they would be allowed. If they got any more than that, they'd be taken to jail, or they wouldn't be allowed to get more rabbits to feed their family. I believe that, like I said, there is so much more that we can do. And I really think that it would be good to call in other individuals that could really put a more perspective on this. People that have helped write what the Truth and Reconciliation Commission is. They were actually part of the commissioners that sat on that board of Truth and Reconciliation. And they're here in Ontario. I know that. I learned from those folks. I learned from my own family's experience. I learned from my own life experience. So is there more that can be done? Yes, there is. It's how far do you want to go to take this? How far do we want to go to be able to understanding our partners in walking with that open heart and that open mind and walking in parallel? We talk about the opioid crisis, and I know that I started off with the indigenous communities because that's what I know. But we as a group, we walk in parallel because we all face that. We all face that trauma, whether it be a family member, a neighbor, a son, a daughter, a grandparent that we have lost to this crisis. Yet we still come together as one. And reconciliation, that, like I said, it's being used as a buzzword. But we're coming together. We can come together as one to acknowledge and try to repair what has been done in helping each other and understanding each other. And I'll just leave it at that because I can go on, Kevin and others around the table. I have become very passionate about this in my teachings and my understanding, and I don't want to waste the board's. I don't want to take up the board's time when this isn't really the correct time. Maybe is the best way to put that. Thank you.
Thank you, Nick. And I think it comes down to what do we need to do, not what do we want to do, but what do we need to do. And I'm going to share something here that this is affecting my cousin right now. His daughter from Manitoulin is missing. Her name is Juanita Mayquans. She goes by Winnie. She's been gone 3 weeks today, and there is no sign of her. So missing Indigenous women is still happening, and it's, I think, starting to get closer and closer to home for some of us. So I think a lot more needs to be done.
I agree with you, Chair. I'm going to share another story with you, and I don't mean to go off topic here. Last weekend, I went with a group of my fellow companions to go hunting. We had a 75-year-old gentleman that was part of our group. He was told to stay on the road that we were where we were practicing our harvesting rights. He ended up going off the road, and about 10:30, 11 o'clock, we started becoming very concerned because we hadn't seen him in 2 hours. Some of our group had gone back to camp already to get breakfast and lunch ready or whatever. And 3 of us stayed in the bush. I told 2 of the other folks that were with me, I said, you need to go back to camp. And I says, you need to get these folks, everybody back out here. We're gonna have to start to do a search here. And why I'm bringing this up is relates to what you just said, Chair. I phoned in at after conducting ground searches with our parties. I realized that this was a very fast evolving, changing decision that had to be made. And I said, we need to phone 911 at that time. And we phoned 911, and of course they dispatched who they thought they needed to dispatch. And they told us and told myself afterwards Had I left that call 20 minutes later, we would not have had response from the OPP with the use of their helicopter or by any other individuals until the next morning. Even though that person was 75 years old. And it put it into perspective that we were downplayed at first. The minute that I said that person was non-Indigenous and that he was 75 years old, had heart conditions and metformin and that kind of thing, they put that helicopter up in the air. And they found him. They did find him. He was alive, but also going into cardiac arrest. And they told me as plain as day, 20 minutes later, you would not have got anything. And we recognize this as Crown land, but it wasn't until, like I said, we said that he wasn't Indigenous, that they put that up in the air. So this hits very close to home with what you're saying about missing women, missing men. I think of those two boys that right now are still missing. 31 years ago, they went missing from our community. They never responded. And they're still missing. I look at another story about in our community where one of our community members, an elder, had wandered. He was actually in one of our hospitals in the region. She left the hospital grounds or had walked out through the door. She had Alzheimer's. And the police did not search for her properly. They found her the next morning. She was 20 feet from the institute, from the facility where she was, in her nightgown and slippers, and she had froze to death because they wouldn't do the search. These are just little tidbits of just in our region alone. You take Canada as a whole, these stories are across Canada nonstop. And again, I would say that we need to invite somebody in to be able to explain this. And this isn't about shame. This isn't about blame. This is reality of what we face as Indigenous people, day in and day out. And like I said, I will leave it at that because I don't want to. I want to be able to continue on with business, but I would prefer that we have somebody that I can look and see if that's what the direction is from the board, to be able to have somebody come in and speak to this. But I know right now that it will take a day just to hit the topics of lightly and not diving deep into them. But there will also be points in those discussions that could trigger. And that's one of the things that we share as I do training with individuals on this. There may be things that I trigger on people where they need to be able to reach out to those that they need to reach out to. Whether it's, mental health or whether it's 911, just to make sure that they're protected. Because like I said, some of these things that we mention in that training or that I mentioned in training are actual facts. Life lived facts.
Thank you, Nick. I don't want Nick to step there then. Is that something the board would be interested in? day, that was someone that, Helen Claire?
Yes, absolutely, Madam Chair. And may I also add a comment?
Yes, go ahead.
Thank you. My colleague's presentation is very, very moving. I'm of the opinion that change starts at the individual level. Mahatma Gandhi famously said, we must become the change we want to see. So my colleague, Mr. Saunders, spoke about having an open heart and an open mind, but many of those kinds of qualities are at odds with Western culture, even with how we do things. For example, rules of order around the table can be at odds with that open heart and open mind. So with that in mind, with the idea that change really needs to start at an individual level, with in mind that for me, I don't want to be part of grand gestures, and I think I'm afraid that making pronouncements about reconciliation can just allow people to feel good and not really do anything. So I'd like to ask through you, Madam Chair, to my colleague, Mr. Saunders, specific to our public health unit, how are we doing? How is the public health unit in relation to First Nations in this larger region? What are we doing well with regard to true and meaningful relationships? And what can we do better and how? Thank you, Madam Chair.
Thank you. Nick, do you have a response?
I think, I think as a board, I think we've started a good sense of moving forward. Do we have a lot of work to do together? I think there's always work to do together on a relationship building. I think that, and I'm going to refer back to Dr. Era because I do respect Dr. Era. I think Dr. Era has really come above and beyond when it comes to, let's go back to COVID. And we had reached out to talk about vaccines and stuff. And it was Dr. Era that I linked up with via phone to be able to ask those questions. And we had a large talk over the vaccines. Sue, I think you were a part of that as well in some of these early on conversations. And Helen, you were a part of that as well. And had it not been for you folks that I just mentioned there, and I know that the other individuals were around the table too, but it was the driving. You were able to see that driving going forward, that what the federal government had stated about being able to vaccinate those people that were vulnerable or were at higher risk, we're going to be able to have that vaccine. And it was you folks that helped to drive that. We're talking about land acknowledgements. We're talking about what is truth and reconciliation. We're already starting. I use this term lightly. We have to learn how to crawl and walk before we can talk. Well, we're like a bunch of toddlers that are starting to be able to use our words in a positive and meaningful way. Next week, I'm going down to IFN, which is the Independent First Nations. And it's our quarterly meeting down there. It's normally resides for the chiefs and for delegates of each First Nation across those independent First Nations. And they're talking about policy. They're going to be talking about policy at that. And I asked Dr. Era, I said, Doctor, is this something that I can speak to about what the work is that we're doing within Grey Bruce on the opioid crisis? Dr. said, yes, you can talk about that. So I'll be putting that draft or that resolution that was passed at Alpha, I'll be putting that forward to the chiefs at IFN. They're going to go, I can see what's going to happen is they're going to go back to their home communities. And they're going to be reaching out to their health units saying, why is this not being done? Or why are we not seeing, why do we not have a seat at the table? That was something that was even shared at the Alpha board that Dr. Era may be able to speak more to. Is out of all those doctors that were down there and board members that were in that room, we were asked afterwards, how did you guys do this? How can we replicate this to be able to advance relationships, to be able to walk with that open heart and that open mind, and how to start to heal, not just as a First Nation, but jointly together as our neighbors and our brothers and our sisters as we walk this path. Dr. Era, I would ask if you can speak to what you heard down at that Alpha Symposium, in case I've missed something or have spoken out of turn, I guess is the best way to put that, without meaning to speak out of turn.
Thank you. Through you, Madam Chair. Thank you, Nick, for your comments, for your vote of confidence in me. And I echo everything you said about the journey and the healing. And it's not just for us. It's not for people who are around this table or in Grey Bruce. It's for our children and their children. There are many things we can do. Start with what you mentioned about the Alpha. You're correct. There are board members and unleashes from across the province in that room, and literally the whole lunch break, 1 hour, group after group that would come to our table, Nick and myself, and ask the same question: how did the board in Grey Bruce and the First Nation community come together? How did you establish this? How are you working about this? So again, it's not one facet, and people around the table know that we can do more, and we are willing to do more. The things that we did right, I do believe, and when I'm using the we, I'm using the collective we in Grey Bruce, the community, Indigenous community, and the Board of Health, and the local political leaders. It stems from the fact that we acknowledge that there were injustices in the past that made the community at disadvantage. In the vaccine example, for example, we have priority for vaccine for older individuals, for first responders, police, paramedics, and acknowledging that history puts that the community, the Indigenous community, at disadvantage. The number of people who are in a household are higher than the number of people in a household and outside of the community. The paramedic working in Grey Bruce versus the paramedic working in the community itself, the level of risk is higher. So we gave that priority to the community, rightly so. And again, we are being technical to provide the vaccine to the people who would most need it, but at the same time, doing the right thing there would simply acknowledge the history, and it seems it provided some healing. So that's one example. Can we do more? Yes, we can do a lot more. And if I can hook it up to the item that we talked about 15 minutes ago about the list of skills inventory list on the board. Yes, you need technical skills, but at the same time, we have a lot of political skills. Around this table, I've witnessed in 2020 and 21, a number of initiatives that ensure the health unit is protected legislatively, protected socially, and we managed to I should probably provide just a little bit of information there before I branch it back to where we were. Many organizations in Ontario were trying to do their best during the pandemic, and there was stepping on each other boundaries. The local political leadership around this table, the skills, the political skills, were key to ensure these boundaries are strong and our health unit operated. If we take these skills and apply them to initiatives related to Indigenous health, and Nick, I don't want to steal your thunder, I'm just going to reference one of the many things you're working on. Nick is working on an initiative that most likely will go provincial and could be national. And to position it for success in the next spring, I do believe people around the table have the skills to advocate, have the skills to provide information to Nick and the team working on this initiative, how they can position it for success even more and more. Who are the key political players at the province that we need to connect with to augment this work. Because I'm giving a vague example here. And Nick can elaborate more if he wishes when the right is time, when the time is right to unveil that initiative. But again, really starts
I
with
can
all
share
of
with
us
you.
wanting to do the right thing.
I can share with you, Dr. Era and the table. As we've started doing this work, and especially on the opioid crisis, a thought came into my mind, and it wasn't. It was a thought, and then it started to evolve, and it started going around in my head even more at 2 o'clock in the morning, to the point of where I got up and I had to write it down. So my thoughts were to recognize and to understand the opioid and the impacts that it's had in our communities. I reached out to a military buddy of mine that I told him about it, and he said, "You know, this is a really good idea." He says, "And I'm willing to support you in this." So my idea is to start with a pickup truck and a trailer and put white crosses on it for every individual that we've lost to the opioid crisis. And this walk would be broke up over the course of time to bring that awareness to not only the opioid crisis, but the homelessness that we face within our country. And this walk would start, obviously I would start this walk up in Tobermory. I would take this walk through many of our region over the course of the weekends, because I don't think we can do it all in one shot. And we would pick a route, and the OPPs actually got on board with this as well, to be able to follow what protocols they need to follow to be able to assist us. And that is walking from Tobermory to Queen's Park and taking this to Queen's Park, because that's the first step. I don't agree with everything that's gone on with this open liquor, and the fact of that you can buy liquor wherever you want to, and the fact of, you know, it's so easy to be able to get these narcotics. And even though they're in these shops, they're still, some of these products, they're still actually laced with the opioids, even though they're in a dispensary. I know that firsthand because of the fact of that we've had individuals that have been lost in this community and in our neighboring community of Saugeen. And I believe that we not only do we bring awareness, but if we do this right, I think that other health units can start in their region. It starts with one voice, but it ends with many, because it takes a community to bring awareness and to raise awareness and to raise children. And again, that goes back to a fundamental teaching within our culture. And I would encourage the mayors and the wardens that are, I would hope that they would partake in this as I start to get ready to do this walk. And I wasn't certain that we had enough time to do this in the fall, even though homelessness doesn't have boundaries for summer and fall and winter and spring. Nor does the deaths from the opioid crisis that we face. But to make sure that I was getting to the all the proper channels and checks in place, I thought we should probably wait until either late April, beginning of May, so that we could make sure that we have everything in place that we need to have in place. And I hope that would send a message as part of what we do at this table, that this would send a strong message to those individuals that sit in Queen's Park, that enough is enough. We can't keep on losing the generations of people that we're losing to this crisis. And I say generations because we have kids that are 2 years old that are parentless now. People don't grow up to want to become drug addicts. They don't grow up to become homeless or want to be homeless. It's time to bring awareness to this. It's time to put dollars behind this to make those positive impacts for everyone and future generations to come. Thank you.
Thank you, Nick. Yeah.
I'd like to make an amendment to the motion. But I'd also like to say something to Nick. See, you're waiting until April, so that walk will be a lot quicker because you're gonna be in black fly season then, coming down the peninsula. Excuse my chance at humor there, Nick. There's nothing humorous about this. So my amendment would be that the Board of Health endorse the National Day for Truth and Reconciliation, recognizing missing Indigenous children in the legacy of residential schools, and support any stroke out additional related recommendations that stroke out may arise on this legacy topic. And further, that the Grey Bruce Health Unit continue to develop initiatives and actions to address these legacy issues.
Thank you. I think that does it very well.
Hope so.
Good job, Kevin.
So
And I don't think I actually had a mover and seconder on that, so that will be our motion, what you have just said, Kevin, and I'm hoping Phyllis has got all of that. Perfect.
okay.
So we need a mover and seconder. Kevin? Nick, would you like to second that one?
I certainly will.
Thank you. Is there any further discussion from anyone? Ken, go ahead.
I'm sorry, is this on the amendment, Madam Chair, or is this on the main motion?
We didn't have the main motion on the floor yet, so we have just amended the motion that is in the
Okay.
document, and that is the motion being brought forward.
Okay, thank you.
Okay? Any other comments? I will call the vote then, all in favor. That is carried. Thank you, everyone. And that is the end of our business, so we are adjourned.
I'll move that.
Moved by Sue, seconded by Kurt, all in favor. Carried. Thank you, everyone.